Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about the challenges that you may face in the medical billing and coding field. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. I have been a medical coder for over 10 years. Today's talk is not to discourage you. I want to outline that immediately because a lot of times when I say things that are very real, and today is a real talk thing, okay? When I say things that are very real, people start to panic and I get a lot of messages afterwards. Wow, I'm so scared and I don't know if I can do this. And guys, this is not meant to be that, okay? I am not trying to discourage you from anything. This is to prepare you. These are the things that people don't talk about a lot of times, okay? A lot of times when people are trying to get people into these programs, they are talking about the nice things, okay? They aren't talking about the real talk. And I'm talking about the real talk so that you all can be prepared. Because I'm the type of person that I would like to be prepared rather than to be blindsided and, okay, I never expected that, right? So here's some of the things that you may run into, some of the the not so glamorous side of medical coding, okay? So the first one is that there's always going to be people that know more than you. Everybody has a different knowledge base. Everybody comes in studying differently. Everybody came in with a different training approach, however they were trained. Some were trained on the job. Some learned from a very good school. Some learned from a not so good school. So that's something that you have to expect. But the thing is, those things can be worked with because you're going to constantly learn. There's so much to this field. And doctors, think about this. Doctors get 10, 15 years to become a doctor. We are medical coders. We got to know the same things that they know while never having gone to medical school. So because of this, we need to cut ourselves a little bit of a break, okay? But it doesn't mean that we don't need to continue to study, because we do. And you can't say, well, I didn't know because I'm the medical coder. Not an excuse. You need to study. You need to make sure that you know, okay? And so that you can be prepared. The other thing is that you may have providers that do not take you seriously because you have a credential. Some people just have a credential. Some have their degrees. And even with their degrees, providers still do not take them seriously. My coding hero, who has her degree, is sometimes not taken very seriously either. And I've seen them do that to her. But I've seen where it's a complete turnaround, because when they see that she was right all along, then they come back and they say, well, you know, I was just having a bad day or whatever. But it does happen to the best of us, even to those of us who really study and who really try hard to present our arguments well and to present this information to these providers very well. Because sometimes providers need to be educated. And when they need to be educated by us, right? The medical coders. Sometimes they are educated by the clinical documentation improvement practitioners, but not every facility has those. Okay, that is a really good position to be in, is that clinical documentation improvement specialist, because you're really working with the providers. But every coder has this ability to be able to do this, whether they know it or not. You don't necessarily have to be credentialed in order to do it, because that is what we do. In the grand scheme of things, we are always looking for ways to improve and how can we make this more clear and what is actually happening here. We need to make it as clear as possible. So with this in mind, sometimes providers will have this little bit of a resentment attitude towards the coder for trying to approach them. This is why I stress this all the time. You have to make sure that if you are doing emails, that your English is perfect. Your sentence structure is perfect. You're getting right to the point. Perfect. Not, I'm sorry, I have a question. Never, ever, ever apologize for trying to help your provider. Never do that. Never apologize for asking a question. I say this a lot, and I'm going to start saying this even more, because even though maybe you're a student right now and you're not in the medical billing and coding field just yet, doesn't mean that you can't start developing these good habits now. When you are sending questions, even when you're sending me questions, make sure that your sentence structure is good. Make sure you're using good punctuation. Make sure that you are using good language. Everything needs to be perfect, because these guys, they're going to look for anything and everything not to listen to you. And they are going to want to discredit you, especially if they are the type of providers that are going to say, well, I want you to code it this way because I know what's best and you will do this. You have to be strong enough to say, no, sir, no, ma'am. According to the documentation, according to these rules here, this is not acceptable for this code selection or this procedure selection. You have to be able to do this because it's going to happen. I mean, in every medical coder's career, this happens. And yes, while some say, well, I don't really take a hands-on approach, that's never an excuse. When I hear that, it's never an excuse, because you should take a hands-on approach if at your facility, there's not somebody already taking care of that, okay? Because most of the times when you look in these job descriptions, they're going to say that they want coders who can train their providers. Well, Blue, I'm brand new. I can't do this. Yes, you can. Because as much as people have experience, there's people who have years of experience who have shied away for many years from doing provider education. So they get tripped up, and maybe they don't have all their references, or maybe they have a because I say so type of attitude. This is where you have to make sure that you're really preparing yourself. You're coming in with your evidence. I'm always going to go back to the lawyerly talk. I wanted to be a lawyer when I was a kid, so I always had that in my head. Anyway, you have to have your evidence in order to support your argument. And you have to be able to approach them in a very professional manner, because these are alpha personalities. Now, some of the books that I recommend, I have them in the description box below. Working on having those leadership skills and building those leadership skills is really going to help you down the line, because you have to be able to communicate with alpha personalities. In order to do that, you need to get those alpha personality skills. And in order to do that, you need to work on yourself personally, especially if you feel like you're very shy and this is something that would be a challenge for you. It's a challenge, and I say challenge because challenge is an opportunity for growth. It is an opportunity to get better. It is not an obstacle that you can't get over, okay? It is just a challenge. And once you master that challenge, then you can go on to a greater level of enlightenment, okay? Which brings me to another thing. You will sometimes have coders, your own people, who will argue with you, who will say that, well, we code it this way and this is the way that you will do it. If that coder cannot give you a solid piece of evidence why, or they can't explain it without showing you something, then you need to make sure that you have your argument fully backed up. Why you selected this code? Why does the procedure code support it? Why does the diagnosis code support it? You need to make sure all of those things are in line, because you will have senior people or people who have been there longer than you to say, no, this is the way we do it here, and that's the way you're supposed to code it. If they can't tell you why, then you do not follow and just go blindly following, because you have to be able to stand up for yourself, and you have to be able to say, well, wait a second, what about this? Because sometimes people don't always know about different resources, and they don't always know like how to look at something in a different point of view. So having that, again, is really huge. You have to be able to do that. But you don't want to be one of those people that just argues just to argue if the person has shown you why the answer is correct. Because yes, new coders are going to need that helping hand, and they're going to need to know, well, wait a second. It's done like this because of this, this, and this. If they can do that, then you know you've got a good person, okay? But don't always say things or do things for the sake of arguing, okay? But that is part of what we do. Because as they say, ignorance is not an excuse in this field. You have to be able to know the rules and to study. And it's a lot of studying, guys. I'm not going to lie to you there. It is a lot. And there are some coders that just go by and they just do the bare minimum. When you do the bare minimum, I will say this. The provider loses, the facility loses, the patient loses, and you lose. Why? Because if you're doing the bare minimum and you're not actually looking at the documentation, you're just sort of going through the flow and just hitting enter, 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 and just saying, well, it's there, it's okay. You may be missing credit, or credit that is being given may not even be what is actually supported in the documentation. So this is why you have to know all of these things. And I say these things, and sometimes people don't take them seriously, and then they end up hurting themselves because it's just like, well, I didn't know that, and I've been coding it this way. That's just from taking that one little action and looking. Okay, that is what you have to go with. Okay. But going back to your coworkers, there's going to be times when you're going to know more than them, or there's going to be times when they know more than you. And everybody goes through this. And at the end of the day, how do you deal with it? You have to focus on what is the most important in this scenario. Is it your coworker, or is it your career? Is it your providers? It's your providers, because I've had instances where I've had coworkers who make things not so easy for me. But at the end of the day, I said, okay, it's not about them. It's about the provider. I'm not here for my coworkers. My coworkers know that they can always come to me if they have questions. Some of them don't like this because they don't want to reach out for help. And I don't want to I don't want to ask her. I don't know why. I'm always helpful, but it just happens. Not everybody is as enlightened. And when I say that, like enlightened, I mean that I know that if somebody came to me and said, hey, Blue, I noticed that you coded this way, but have you looked at it this way? I would be like, oh, my bad. I didn't know that. I didn't know that before. Thank you for sharing. I would be all about it, because it's not about my own personal feeling towards that person. It's about the work. It's about my providers. It's about that patient, because you're still advocating for that patient by making sure that all the documentation is there and all the codes that are selected, all the diagnoses that are selected are correct. So again, it is going to be about how you frame your thought process when you're dealing with people who are a little bit of a challenge. And you have to know that when you start reading these books about leadership skills and how to work with different personalities and things like that, it's only going to benefit you more. And then you may be able to reach another coworker who may have been a challenge before to reach. And then you never know that action may help them. It may help them to be more high caliber. Because at the end of the day, you want to be a high caliber coder, right? That's what you want. That's what everybody should shoot for, is being that high caliber medical coder. But it takes effort, guys. It's not something that could ever be handed to you, or it could, something that's very easy to come by, because it isn't. And there's always going to be these challenges, okay? The other challenge is if you are housed away from your providers. Maybe you're still working remote, or maybe you when we get back to somewhat normalcy, you get into a room and there's a lot of people and there's lots of talking. Okay. Oh gosh, it brings back the nightmare, and I hope my eye doesn't start twitching. From when I was in this horrible little tin can of a room. There was 20 of us in there, okay? 2 supervisors, 20 coders. It was horrible, absolutely horrible. And both of those supervisors did not really like to get onto the girls at all for talking. And it was just like, it would get so loud and everybody would complain that it's everybody's just so loud. But you're part of the problem because you're talking. And yes, you want to be able to talk, and you don't want to go through your whole day not talking. But at the same time, there's a thing with headphones, which is what I had to get. I literally got myself a set of Bose headphones so that I could just clear out the noise and I could just listen to my music and I could just work. And that was how I got through that time. Some of the girls would because where I sat in this office, and I have ears like a bat, so even with these headphones, I could still hear, but they would come by my desk and they would shake my chair and they would like pull on my hair and they would like, hey, how you doing? And I'm like, no, I'm trying to concentrate. I want to get my work done. And then you get the girls that say, well, she's always working. That's why we're here, ladies. That is why we're here. And so that does happen. And sometimes it's just like, but at the end of the day, I'm not there for them. And after a while, they got the point where, okay, well, she just wants to just be left alone. Yeah. I mean, I'll talk to you if you say hello, good morning, or whatever. But at the end of the day, my quota and my accuracy and my production is far higher on my my importance list than you. And so I will help people when they come to me like that. But if it's just to socialize and talk, I have been in too many situations where they just want to drain your time and then you're rushing at the end of the day. And I never want to do that because I feel like I'm always cheating my providers if that happens. So that's why I don't do it. And I've had to get firmer with it. And reading those books from the Arbinger Institute really did help me. When I went to that Arbinger Institute training, I'm telling you guys, that's supplemental training. That has nothing to do with learning medical coding. It has nothing to do with learning the laws about medical coding, but it has everything to do with your personality and making yourself stronger so that you can be very, very good at this field and very good at what you're doing. And that is, some of those things. And the other non-glamorous thing is the RVU generation. Now, RVU, if you don't know, that is every procedure, every evaluation and management code is assigned a RVU value, which is relative value unit, okay? Now, this means that every procedure, every evaluation and management code is paid out differently by insurance companies at a different rate, okay? So hospitals use RVU generation, however many RVUs that a procedure or a E&M is generating, however many that provider is generating, to see how their production is. That's how they know. They're not going to go by, how much money they're generating. Yes, they do go by how much money they're generating with the insurance company, but in order for them to get a standard set of what they're producing, they go by the RVU generation. When coders are coding and they're entering all of these E&Ms and these procedure codes in, they're seeing the RV, and this is on the outpatient side. I'm talking about outpatient right now. I'm not talking about inpatient. That's something different. But they still fall under that anyway. But when they start using all of these things, right, they use these numbers to see how much these providers are actually doing in a day, right? How much are they generating? How much money are they generating? So they use this for like approval, if they can go on leave, if they can do other things. That's how they know how much production that provider is getting. When the provider starts to have a dip, because they do have a goal, right, that they have to do, all of them have goals that they have to meet. And if they don't start hitting these, there's a dip and the coder is going to get blamed. The coder gets blamed because it's the coder's fault. They're not picking up the codes like they're supposed to. But if you've already had your proof that you've tried to educate this provider and all of the things that you've told them by email, always cover your tracks, people. If you have your proof that you've tried to educate this provider and they come back and say, well, it's the coder's fault that I'm not meeting my RVU generation. Then they come and ask the coder, hey, what's going on with this, Dr. So-and-so? And then you tell them, okay, well, here you go. Here's all the evidence that I've tried to help them and they've refused my help and they've just not listened to what I've said. Then it goes back to the provider. But when the RVUs go up, it's the coder. And then, but no, it's me. It's what I did. So it's sometimes a thankless job where they're making money and we don't get thanked for it. But it's okay because it's not about that. It's about doing the right thing. It's about being in this field and getting really good and learning and, doing all of that. But this is why these things are really important to know. Yes, it is sometimes a thankless job, but at the end of the day, it's going to be how you look at it. Okay. It is a team sport. It is not, there is no I in team. There is no I in coder. There's an I in medical coder, yes, but there is no I in coder, and you have to look at it that way. It's teamwork. Okay, so that's just some of the unglamorous things, you know, being in a small uncomfortable place, or being in a crowded place with lots of noise. You just have to use headphones, or if you're working at home, having that disconnect from your providers and everything has to be over email. That's when you can get better with writing and getting more to the point, and not sending them like a 4 or 5 paragraph email, because they have very little to no patience. Okay, it's about, you know, standing up for yourself and letting them know that, you know, you are there for business, and this is very serious, and you take it very seriously. And when you come to them with questions, it's not going to be questions that's going to be wasting their time. And I've seen coders try to say, well, you know, I went and asked them, what did you ask them? And it was something very, very basic. But I just wanted to see what they would say. Why are you doing that? Why are you trying to waste their time? If they know that you're wasting their time, they're going to lose patience with you. And you don't want that. You want them to be able to know, hey, if she's coming to me with a question, it's a legitimate question, and it is because she's exhausted or he's exhausted all other means of trying to find this answer. And now they're coming to me. So that's my show for today. But it's a lot, right? But again, I hope this doesn't discourage you. Please don't let it scare you guys. Please don't send me emails and say you were scared by this, because I hope not. I just want you guys to know that this is out there. This is what you're going to be able to expect. Okay, but I've had many other videos where I talk about the really good things too. So be sure to go through my videos. I'm going to wrap this one up. Thank you for watching. Hit that subscribe button, like, and share this if it helped you. All right, I will see y'all on the next episode. Bye.